Hi, my name is Nate. I'm here to demonstrate an IV scenario. I am wearing my uniform, including I have my student badge. I have everything, no nails, no earrings, nothing. Everything is gone. I do have my watch to time my medication that I'm going to be, the fluids and the medication I'm going to be giving. Before we get started with anything, we always have to introduce ourselves to our patient. I have to let my patient know who I am and what I am doing today. It's really important. It's extremely important to check the patient's six rights, which is the patient, med, dose, route, time, and documentation, and always do two patient identifiers, which can be date of birth matching the name, and also always look at the MAR. That the fluid and medication that's the doctor is prescribing matches the patient. Always ask the patient about allergies, if they're allergic to anything, and before I even start before anything else is I give patient privacy. So the patient has privacy. I identified two identifiers. I went ahead and did the six rights, and then asked the patient if they're allergic to anything. Patient says no. Okay. Math wise, I got two things here. I got the fluid. I got the fluid. What am I doing? I got the fluid, and then I got the meds. So it's one for the fluids, 150 ml over 60 minutes, which is 15 GTTS per ml, equals to 220. I can't see it like that. 2,250 over 60 comes out to 38 GTT per minute. For the medication is 15 GTT over 100 ml with 15 minutes. 1500 over 15. We're going to be giving 100 GTTS per minute. Okay, so that's the math I got for today, um, which shows on our bags 15. Okay, all right, so this here is our primary tubing. This right here is called the spica. This goes into the bag. The fluid goes through the spica. This is a sterile process. Fluid goes through spica, goes into this chamber, goes all the way down. We do have a roll clamp here. Okay. This is what controls the rhythm. This is the medication. Control the rate. Okay. Fluids go all the way down. This is the Y port. This is the extension part. This is where you put meds. Okay. Will be another bag, or you push meds. This is the Y port. This right over here is the port. This goes into the IV. Okay. So before we get started, hand hygiene. Make sure that the patient understands what's going on, that they're not full of surprises. Hands are clean, getting my gloves on. Also make sure when you do hang the bag is about 30 inches. The bag is 30 inches above the patient's IV site. So we're going to take this. We're going to prime the bag, which is our saline bag. Goes right over here. I'm going to go ahead and clamp it. Making sure, like I mentioned, it's above the patient, 30 inches, okay? Has to be fluid in here, okay? Just squeeze. Let the fluid go in. And now we're going to prime it. We're going to make sure that there's no air bubble in the tubing. No air bubble, okay? So we're just going to prime that real quick. Okay. Making sure that everything fluid's in there. Meds are good. Bag is good. Okay. Come on. Now we're going to go ahead and, because it's the fluids, it's going to be 38 drops per minute. So we're going to count, come on, for a full minute. So it can be 38 drops for a full minute. Okay. And then you can adjust the rate just in case if it's going too fast or too slow. You got to keep an eye though on the fluids that you're watching it. So always keep the watch closest to the chamber. Okay. All right. So we're going to go ahead and stop that. So that was a full minute. We're going to take that alcohol swab that we have here. Where'd it go? And then we're going to clean the Y port and let it dry. And then next is going to be putting our second fluid, which is the antibiotic. So what we're going to do before we put the fluids up is we have to always understand that the bag needs to be lower than the fluids, the medicine fluids, I'm sorry. The bag needs to be lower than the medication, okay? So I'm going to go ahead and take this off. Do hand hygiene. I'm going to prime the next tubing. So our white port is dry. Okay. Same thing. We have the spica that goes into the medicine. You're going to put the meds in here. You're going to squeeze a couple of times. Fill it halfway, just close to halfway. And then we have our roll. So I'm going to go ahead and close the roll. I'm going to put the chamber into the bag. Close the roll. So we're going to put this one down here. So the fluids goes lower. And then this goes here. Above, a couple inches above. We're going to go ahead and squeeze, squeeze, squeeze till it's half. And then we're going to go ahead and prime the tubing. Make sure that there's no, prime the tubing, make sure that there's no bubbles, no airs. Okay. We're going to take this port and then we're going to attach it to this wide port. Okay. So this is all ready. So for the meds, it's going to be 100 drops per minute. So we're going to just let this one go just a little bit. Clear the line. Okay. So like I said, we're gonna make sure that there's meds in here. Okay. And then what we're gonna do is we're gonna count for a full minute and give a full minute of 100 drops per minute of the amoxicillin, the meds. Make sure that this medication's gone over with the patient. The patient understands what we're doing. Um, like I said, it's extremely important to ask the patient if they have allergies to anything, any medications. I'm sorry, allergies to any medications before we even start administering this. So always go over the six rights. Always go over to patient identifications and ask if they're allergic to anything. So let's go ahead and do a full minute of um, of our 100 drops per minute. Okay, perfect. Now what we can also do is just clear the line a little bit. Okay, both of them are completely closed. Medicine is done. I went 100 drops per minute. Take gloves off. Perform hand hygiene again. Perform hand hygiene again, making sure that everything's good. Important things to figure out with the patient after this is making sure to see that the IV site is dry and intact. It's important to make sure that the patient's not having any allergic reaction, making sure that the patient's educated in regards of what was going on and what to do in the follow-up. Um, Definitely let the patient know what the side effects and adverse effects are from amoxicillin. Let them know that there's, hives, rashes, nausea, vomiting. That is extremely important for the patient to understand that things like that can happen. And also, what's important to know is that the patient, um, the patient verbalizes the understanding, and that is it.